Established in White Plains, New York in 1991, the NeuroOrtho team of doctors Seth Newbart and Jack Stern offer experienced, personalized care for patients in need of minimally invasive spine surgery. Practicing in this private hospital, both doctors are hands-on, using the latest, safest technology available and serving as the only caregivers to their patients.
It's not a clinic setting, it's more of a boutique setting. When you come here, you see right away Dr. Stern or you see me. There's no physician's assistant, there's no medical students, no nurses, no residents. And we evaluate the patient. When the patient comes here, we go through all the records, we speak with the patient, we examine the patient, and then we come to a diagnosis. And that's really a critical step, is having the proper diagnosis for spinal surgery.
We really complement each other in a very interesting way, and I think it's a paradigm that is now being emulated in many places in the United States. If you've met Dr. Newbart, you know not only does he have a terrific sense of the spine, but he's also an inventor and very creative. In many ways more creative than I am. I think one of us is more left brain, I think the other one of us is more right brain. So it's an interesting complement.
Orthopedic surgeons typically specialize more with fusion surgery and with the implants such as the cage, plates, screws. Neurosurgeons historically have been more involved with the nerves and tumors of the nerves. So we each come with a little bit different experience, but we've been working together, Jack and I, for 18 years now. I think you have the best of both worlds by having an ortho and a neurosurgeon working together.
Lisa Green had lived with chronic pain long enough. She tried physical therapy and treating it medicinally, but saw no marked improvement.
16 years ago, I started experiencing pain. I was diagnosed with degenerative disc disease, and I tried various physical therapy, massage therapy, cervical traction, medications, epidural injections, and my pain management doctor said that I should seek out an orthopedic surgeon.
Lisa is just one of thousands of Americans diagnosed each year with cervical arthritis and cervical disc disease, which is characterized by a bulge or rupture of the disc material into the spinal canal.
The cervical disc is a cushion between the bones, and if it wears out, it's called degeneration. And when it wears out, it can cause a herniation, which is a portion of the disc actually moving out and putting pressure on the nerve. If the nerve has pressure on it, the patient will experience pain. Cervical arthritis is more of a degeneration of the bone, where there's bone on bone, and the rubbing of the bones creates the pain.
Most patients with cervical spine disease, it's self-limiting. You've had neck pain, you know that it will go away on its own. It's those folks in whom the pain doesn't go away that we see in our office, and it's only a small fraction of those who actually end up requiring surgery.
We leave surgery as an absolute last resort. So we try everything from physical therapy to chiropractor to acupuncture, massage therapy, shiatsu, reflexology, medications, injections, braces, neck collars, traction, anything that we can do to try to help avoid surgery, we do. When we look to surgery, we try to start with the most minimal approach that we can do. We have a patient and we ask ourselves, what's the least we can do to get that patient out of pain? And that leads us to the different types of surgeries that we do.
Believing a NeuroOrtho team approach is best, Doctors Newbart and Stern have collaborated on thousands of complex spinal surgeries. This PEEK disc replacement is a proven technique which achieves immediate results, relieving the abnormal pressure on the spinal canal while dramatically cutting a patient's recuperation time.
So the objective of the surgery is to take the pressure off the nerve and to stabilize the spine. We're actually able to remove the disc and replace it with the plastic spacer. And within that, we use the patient's own bone. It's not from a cadaver, it's not from a bone bank, it's not a synthetic material. We use your own bone from the local area of the surgery. We don't go into the pelvis and we don't go into the hip. So there's no extra pain. We use a microscope, which keeps the incision very, very small. And that means less post-operative pain. Secondly, we have a very small implant, so there's less dissection that we have to do when we're doing the surgery. So all this adds up for a safer surgery, a smaller surgery, and a quicker recovery.
Understanding the importance of safety, the doctors work in a spine-safe operating room equipped with the latest technology to provide the optimum environment for a safe and uneventful procedure. ultra specialists treating only spinal problems, Doctors Neubart and Stern do all of their own surgeries, giving patients the ultimate in hands-on, experienced care.
Both of us trained in big medical center, he at NYU and myself at Columbia Presbyterian. We opted not to work in those centers. We could have, and we opted not to. Because if you work in those centers, by the nature of them, you have residents involved, nurse practitioners involved, PAs involved, and we really wanted to incorporate curing and healing together in one practice. I've been a patient myself, I've had surgery myself, and I know it makes a huge difference to see my doctor, to talk to my doctor. It's just comforting, it's very healing. I could have somebody else cure me, do a surgery and cure me, but it's really nice to have that component, and Seth and I are really committed to that approach.
I'm able to do things independently, whereas in the past I had to rely on others. I am enjoying my children, I'm enjoying life. I'm free of pain. One of my concerns was what the scar would look like, and as all women, we're vain, but the procedure left me with a very small incision, and the most important part is that I can move my neck. I'm not in pain, and that, above all, is what was important to me, and I'm grateful for that. I would recommend this procedure to anyone else who is seeking out pain relief. Dr. Neubart and Dr. Stern virtually gave me my life back. They took away my fears and my tears, and I'm living a full, productive life now.
Dr. Neubart also holds several patents on medical spinal devices designed to improve patient safety and reduce complications. These instruments are currently in use in hundreds of hospitals worldwide.
We're fortunate that so many of our patients do well after surgery, and because we get to know our patients so well, we actually see them get better. We know that they've been able to increase their activities. We know that they've been able to go back to work. We know that they've been able to enjoy their lives again, because pain has the ability to take over someone's life. So when you can help someone deal with the pain, particularly here through a surgical procedure, you've really contributed something to that person's life, and it's very gratifying.
The practice evolves, and for us it's always looking to make the surgery safer and smaller and less painful for the patients. So there's always new techniques coming out. We go to meetings. I'm actually involved with some panels that are looking at new materials to use in spine surgery. So that's really the exciting part. We can do the same thing that we're doing, but make it safer and quicker and more beneficial for the patient.
People entrust us with their lives and their limbs. And it's great assurance when you've got two surgeons, and I say this with humility, very well experienced surgeons, working together with four hands working like two. And I think it gives each one of us comfort, gives each one of us an assurance. And ultimately, the equation means that our patients do better, that there's greater safety in the operating room, much more experience in the operating room when two heads and four hands work together.
We're a happy group of people. We love what we're doing. We love being in the operating room, we love being in the office, seeing the patients. And at the end of the day, you know, if you can take someone who is in pain and bring them out of pain, there's nothing more gratifying than that.
For safe, experienced, state-of-the-art spinal care, learn more about the NeuroOrtho team of Doctors Seth Neubart and Jack Stern today. Because with surgery of the spine, experience is everything. For more information, go to safespinesurgery.com or call the number on your screen.